Good evening, everybody. Good evening, Miss Adebusola. Good evening, Mr. Adewoyin. Welcome.
Thank you so much.
Welcome to tonight. Let's just wait for others to join the meeting.
Good evening, can you hear me?
Yes, I can hear you, sir. Good evening. Welcome.
Good evening.
Mhm. Let's keep waiting for others to join the meeting. It's 8 on the dot.
Right.
All right. It's already 8 p.m. So let's start. Good evening, everybody. Good evening, everybody. Welcome to another enlightening presentation session of ours, the Operating Room Global Nigerian Chapter. Tonight, we will be looking at bariatric surgery, and our key presenter is Mr. Adewoyin Emmanuel. He's here with us. Welcome, sir. Nice to have you with us. Mr. Adewoyin Emmanuel Alaba is an advanced perioperative nurse. He's a registered nurse, a registered perioperative nurse, with a BSc certificate from Lautech Obomosho. He has served in many capacities within and outside the nursing professional. The nursing profession. He has been a project director for Nurses Revolution in Nigeria. Has worked as a general nurse and as a perioperative nurse in both private and government organizations. And also he's a community volunteer in healthcare. Currently, he's working at One Health Medical Hospital in Lagos. And it will please you to know that he's also the current treasurer of the Operating Room Global Nigerian Chapter. And he's happily married with 2 boys. So it's a great pleasure to have him be the key presenter of our meeting tonight. And I know we have a lot to learn from his vast and broad expertise. So with emojis in the chat, we can just welcome him. Mr. Adewoyin, if you can hear me, you can start. We can start the meeting, sir. Hello? Hello, Mr. Emmanuel, can you hear me?
Hello, good evening. Sorry for late response. Good evening, everyone.
Oh, good evening, sir. Welcome.
Yeah, thank you. So this evening, I want to first appreciate the leadership of TORG-NG and Global family for the opportunity given unto me, and I so much appreciate it. This evening, we'll be looking at, I don't know if you can hear me clearly.
Yes, definitely.
Okay, this evening we'll be looking at bariatric surgery. And I know most people are much more familiar with what bariatric surgery is, and if you have not actually hear about it or see the procedure, I'm very sure you'll have read about it. And for some people that actually see the topic, they will have gone through like what the topic is all about. And also, when we talk about bariatric surgery, some people will be like, what's this? And of course, it's something they know, but they don't know it as a bariatric surgery. So this evening, I don't know if you can see my screen as well. Can
Yes,
we see my screen?
yes, we can see you.
Okay, so when we say bariatric surgery,
Yes, we can
they
see.
are the procedure that include gastric bypass, sleeve gastrectomy, gastric band, and duodenal switch. And the operation proven results in treating class 3 obesity. And when we are classifying obesity, we have class 1, class 2, class 3. And because of our time, I will not want to go into that, how the class 1 is being achieved, the class 2 and the class 3. So bariatric surgery also helps normalize the metabolism, that is blood sugar, blood pressure, and cholesterol. So those are the surgery, when we say bariatric surgery procedure, what it entails. It entails different type of surgeries, and what it does, it helps in normalizing metabolism, including blood sugar and blood pressure. And we can't talk about bariatric surgery without touching a bit of anatomy. We are talking when we are talking about bariatric surgery, we are talking about system. The system that involved is digestive system, and we are still coming back to the introduction. So, if you want to consider bariatric surgery, it's important we understand how gastrointestinal tracts work. Surgery may change the size of the stomach or even remove part of small intestine. That is, I said, bariatric surgery consists of different type of surgery. You understand? So it's not one procedure. We have different type of procedure in a bariatric surgery. So we say surgery can change the size of stomach or even remove part of small intestine, depending on which weight loss option. And we have the option, we are still coming back to the type. By changing the amount of food you can eat and how you digest them. So the GI tract is pathway food takes. We know, I'm just going to overview, I'm not going to go to details. From when we eat, the pathway food take from our mouth to the esophagus to the stomach, small and large intestine, and then how the absorption take place, how the breakdown take place in the stomach, the enzymes that are being released, and the breakdown of the food, the absorption, distribution, transportation, and whatever happened in each part of the digestive system. So those are the things that we need to put our mind at when we are talking about bariatric surgery, and when we want to look at the system that is affected. So that is a digestive system. So, and until we actually excrete whatever we take. So that runs through the digestive system. We have the diagram of the digestive system. You can see esophagus, stomach, and also duodenum, small and large intestine, cecum, and all these diagram we are looking at, they are very paramount and they are key when we are talking about bariatric surgery, especially the stomach and the small intestine. So there's a specification regarding this: the esophagus, the stomach, duodenum, and the small intestine. So those are the area that is most affected. So, and also, the stomach, we know the stomach is a reservoir, is the first part of the gastrointestinal tract, and okay, esophagus, then the tube esophagus is the tube that connects from mouth to the stomach. I just want us to refresh a bit of anatomy, just brief discussion. We are not going to go to it. Then stomach, what does stomach do? Stomach, actually, digestion did not start in stomach. We all know that stomach is just like a reservoir, create acid to digest the food. You understand? So and we say stomach doesn't absorb food or at all. Food only stay there short time. So the muscle contraction push the food down into the small intestine. And when we are talking about small intestine, we are talking from the duodenum downward. That's where we have a bit of absorption. So when we are talking of small intestine and large intestine, we know this is our small intestine, large intestine. We have the small intestine consists of three parts: duodenum, jejunum, and ileum. In these three parts, food mixed with digestive fluid, that is, and its breakdown, then the absorption of the small intestine also absorb nutrients into the bloodstream. In the duodenum, what happened? Bile fluid from the wall of the intestine and other fluid from the pancreas mixed with the food. Then the mixture of the food move into the jejunum. So where food get broken down into essential elements like carbohydrates, fat, protein, and other nutrients. So essentially in jejunum, that's where the breakdown occurs. Finally, food move into the ileum, where a lot of nutrients and water are absorbed into the bloodstream. Food and digestive fluid that aren't absorbed keep move into the large intestine, the colon, where it's stored until one uses the restroom. So these are the overview of what really happened in the large and the small and large intestine. So I believe we have the refresh of what happened while we are talking of digestive system. So what is bariatric surgery? Bariatric surgery, also called weight loss surgery, is a category of surgical operation. Like I said, it involves series of surgery, not only one surgery, that intend to help people with obesity lose weight. So basically, it's weight loss surgery. Weight loss surgery. And if you are recommending a bariatric surgery with other weight loss surgery method, you understand a lot of people these days, I think Nigerian, at least majority of people now know what bariatric surgery is, because some people do it because of weight loss. I've seen people that their BMI are okay and they are fine, but because of beauty and cosmetic purpose, they still want to do one of the procedure of bariatric surgery. So healthcare provider may recommend bariatric surgery if other weight loss methods are failed, if obesity appears to be posing a greater risk to their health. So what are we saying when we say bariatric surgery? So definitely there are other weight loss methods. We have diet control, we have exercise, and we have some people do a lot. Some people do a lot of things when it comes to weight loss. So if all these options that we put in fail, so what will happen is that the option of bariatric surgery now comes in. Some people don't even explore other means of weight loss. They just go to bariatric surgery. So, and we said this procedure works by modifying the digestive system, usually the stomach. You know, I said it. The focus is basically on the stomach, the duodenum, and the small intestine. So, and sometimes also small intestine, to regulate how many calories one can consume and absorb. They can also reduce hunger signal that travel from digestive system to the brain. So this is just basically the summary of what bariatric surgery does. One, they actually regulate how many calories one can take and consume, and how the absorption, like the extent of the absorption. Then also they reduce hunger signal from what the digestive system to the brain. So basically, this is just a summary of when you hear, the moment you hear bariatric surgery, just know that, oh, they are talking about, okay, weight loss, one. Number two, they're talking about, okay, I just want to eat small, how many calories I can take and absorb, you understand? And also hunger signal. Let me chip it in. So if you have anybody around you that say doctor, nurse, health workers, tell me, can I have drug for that I will not feel hungry? Just tell them that, go for bariatric surgery. You understand? So because there will be reduced hunger signal. So the procedure can help to treat and prevent many metabolic disease related to obesity. And what are the metabolic disease we are talking about? We have diabetes, we have fatty liver disease, and so on and so forth. So bariatric surgery procedure also helped in treating all these disease. As we go on, we are going to see how they treat these disease process. But weight loss in loss surgery isn't an easy quick fix. It requires preparation before and long-term lifestyle change afterward to be successful. So I'm going to take us briefly on this. And when you say it requires preparation beforehand, so it requires you restricting some diet before the surgery. It requires lifestyle modification in terms of so many things. Restriction in your alcohol intake. If you are addicted to alcohol, there's some things that you will not be required to take. Maybe there's some lifestyle eating habit, or you have to change them. So in preparation for bariatric surgery, another preparation I didn't actually mention is balloon insertion. Most time we prepare patients for bariatric surgery by doing balloon insertion first, especially for sleeve. Let me be specific, for sleeve gastrectomy. Because why? We want to actually reduce the capacity of the stomach and equally drop the weight before the surgery in particular. So those are the things, those are the preparation beforehand. And the person must have seen a dietitian before even saying you must have seen a dietitian for assessment, for series of tests, and also endoscopy is part of it as well. You must have done endoscopy to as well gastroscopy. Some people do the upper and the lower just to know how healthy the stomach and the intestine and other parts is. So bariatric surgery is the most successful long treatment for class 3 obesity. There isn't class 3 obesity because I think class 3 obesity is the highest of the order according to National Institute of Health. So when we are talking about effective, they say most successful long-term treatment for class 3 obesity, that if you want to quickly lose weight, just enroll to take bariatric surgery. It is nearly impossible for people with class 3 obesity to sustain weight loss through diet and exercise alone. So like I equally tell people, starving themselves by saying, I want to continue my diet life and I'm watching what I'm eating is very good. But most time it doesn't work alone. So, and most people get confused when they say, oh, diet, I don't drink this, I don't drink that. It might work for A and it might not work for you. So most people are getting confused about, I tried it, it doesn't work. So a diet and exercise alone is not enough to lose weight. Once body has registered high weight as normal, it continues to try to return to that weight. So you maintain that weight. The more you add up, bariatric surgery works by changing how your body manage what you eat. So it regulates how you eat, because if you have it, you're going to your stomach or your reservoir or whatever it is being reduced, and the amount of calorie and absorption that will take place will just be minimal, allowing healthy diet and lifestyle change to effect for sustained loss of. So all this we are saying about bariatric surgery is just focusing on what I'm going to do to my digestive system that will make me lose weight on time. And also, diet and exercise is not enough to, when we are talking about weight loss. So I'm trying to actually go through because of our time. So we have condition bariatric surgery can treat. When we are talking about bariatric surgery, most people that actually patronize are people that are obese, whether it's type 1, type 2, or type 3. Obesity is associated with many chronic diseases, as you all know. If you are fat, if you are obese, you are prone to so many disease conditions. And it's very saddening, and most people don't take note of this. And most people think, no, this is what runs in my family. My forefather scaled through. I used to tell the people that what your forefathers scaled through, you might not scale through, because we have a lot of environmental and chemical, biological changes now. So obesity is very, very terrible because it causes so many diseases. And equally, when you have this obesity, we have condition that when you have this surgery, bariatric surgery done, it can equally treat those disease condition. So, and we have one of them is high cholesterol. When there's high cholesterol in the body due to excess fat in the body, and that is work of obesity. High blood pressure, we know how that one also affects how obesity cause high blood pressure. And then blood sugar also, hyperglycemia. High blood sugar is linked to insulin resistance and is considered a precursor to diabetes. And that we have type 2 diabetes mellitus. Excess fat storage can lead to insulin resistance as well. So you can see all these things we are saying, condition that is related to obesity. So the risk of developing type 2 diabetes increased by 20%, of for each 1 point increase on the BMI, that is body mass index scale. So we have to be very, very careful when it comes to BMI. Some people, we don't actually follow it. And it's a signal. It's a signal when you actually follow. Some people are on weight loss diet and every other thing, but they are not monitoring their weight. So they are measuring it by, I've reduced, I've lean. No. Sometimes you might be looking lean and your BMI is still on the high side. So we have to watch that as well. So part of the things that bariatric surgery can treat, we have high cholesterol, high blood pressure, high blood sugar, diabetes mellitus type 2. Also, we have heart disease. Obesity can lead to impaired cardiac function and congestive heart failure. We know the physiology of how this one happens. It can also cause plaque to build up inside arteries and increase risk of heart attack and stroke. We are talking of atherosclerosis and other one. So those are when there is enough of fat, so there will be deposit, and kidney disease as well. Metabolic syndrome associated with obesity include high blood pressure, insulin, and all those stuff. So these are a disease condition. Anybody suffering from obesity, whether type 1, type 2, most especially type 3, will be suffering from. And we are saying bariatric surgery can equally treat all these disease conditions. And we have obstructive sleep apnea, osteoarthritis, especially. A couple of patients that come for our for sleep gastrectomy bariatric surgery in my facility, you see them big. At least we recorded close to 200 kg of patients. It got to the time that we are even thinking of combining two operative beds together. But you see them when they come, you see them huge, big giants. And some of them are not huge, big giants. So different, but what I'm saying is that having excess weight put extra pressure on joints, like knees especially. They come down with knee replace. So they come down with knee joint arthritis, knee osteoarthritis. And at the end of the day, they end up doing knee replacement. Some of them that we not think of doing bariatric surgery will do knee replacement. At the end of it, we'll come for redo again. So another condition is non-alcoholic related fatty liver disease, then cancer. Why the connection isn't entirely understood. In fact, we did not know the cause of cancer. So the connection between the obesity and cancer is not entirely understood. Obesity is correlated with an increase of acquiring more than a dozen types of cancer. It also increases risk of death from cancer by more than 50%. So it's very crazy. So these are the conditions that is associated with obesity. Equally, these are the conditions that bariatric surgery can also help to treat. Can we say how fantastic bariatric surgery is in our society? At least I can point it out that the bariatric surgery has saved so many people from all these disease condition, because some of them are at high risk. But when they actually maybe decide to do bariatric surgery, any of the surgery, or they get better. They get better quickly. So also let us look at preparation for bariatric surgery. So before scheduling bariatric surgery, we want to ensure that patient is physically and mentally fit for the surgery. That is very, very important. It also helps in recovery. When a patient is physically and mentally fit, it also helps in recovery because they will be physically and mentally prepared to participate in whatever post-operative order you give them, follow up, and whatever it is. But when they are not physically and mentally prepared, what will happen post-op? There will be a kind of retrogression as well. So patients will meet with a team of specialists, and the team of specialists they will meet with a dietitian, they will meet with a surgeon, they will meet with gastroenterologists, and a lot of specialists that will see them before they will see all this team, they will consult, counsel about the risk and benefits while evaluating physical and mental health. The patient may need to pass medical screening tests to make sure the surgery is safe. This is very important. It's medical screening. We are going to look at patient's medical history and whatever things that will make sure that the surgery is safe for the patient as well. Then, if patients use tobacco, drug, or excess alcohol, they'll be required to quit for a period of time. I remember there's a patient that we attended to. There are two sisters that had a balloon insertion preparing for sleep. So they have to come back the following week to come and remove the balloon that they cannot do. One of them already is banded down. So it's not easy. It's not easy. That's why from the introduction that bariatric surgery is not easy fix. So it's not an easy procedure. So because you are going to, it's like you're sacrificing a lot of things. So those are the preparation for the surgery. The surgeon may also ask patients to follow pre-bariatric surgery diets. That's what I'm saying. So for a few weeks to prepare for the operation, most people, it's very difficult. It's very difficult and it's not easy. All this thing is to reduce fat inside abdomen. You understand? So when they say, okay, don't eat this, follow this, so it's just to reduce fat inside abdomen where the operation will take place, making the operation safer and reducing the risk of complication. Then surgeon, dietitian, and other people will give specific guidelines to follow. So these are the preparations for bariatric surgery. It is a lot. Some people at the middle, they don't comply and they will change their mind. I'm not doing it. It's not easy. It's not their fault. It's just like when they say physically and mentally fit. If you are try fasting, you will understand what I'm saying. And if you are try any method of weight loss, you will understand what I'm saying. So how is weight loss surgery performed? Weight loss surgery performed is usually minimally invasive. It's usually minimally invasive. That's laparoscopic surgery. That is, we know how it is. There's a small incision. It's fast healing, less pain. In fact, our sleep gastrectomy patients, they go home the second day or the third day, as the case might be. The second day, at most the Thursday, the third day. So the scaring too is cosmetic, not that everybody will see. So, and then we have very rarely some patients are better treated with open surgery due to their specific condition. So if we have any open patient, that means the condition warrant that they should open it. Maybe there's some other complication as well. So I don't know if we are following me. Can we still hear me clearly, please?
Yes, we can. Following.
Okay, thank you. And I'm sorry if I'm rushing. So briefly, we are going to talk about different type of bariatric surgery. We are going to talk about the number one. We have gastric sleeve. That's number one. We have also gastric bypass. We have adjustable gastric band, and the fourth one we have biliopancreatic diversion with duodenal switch. So those are the four type of gastric bariatric surgery. So we have the types of bariatric surgery. So that's why I say when they say bariatric surgery, we are not talking about one procedure alone. We are talking about different type of surgery, different type of procedure to achieve the bariatric surgery. So the number one thing we are going to talk about is the gastric sleeve. Number one time. When we say gastric, we know what gastric is. Gastric sleeve is equally being gastrectomy. We are removing the larger portion of stomach, about 80% behind the small tubular portion like a sleeve. When we say sleeve, we know our clothes, we all know how the sleeve is. And when we say gastrectomy, we know it's excision of part of the gastric. So it's a very straightforward, understandable, what's it called, procedure. And if you can see the anatomy, I will be using my, what's it called, to do, I'll just describe briefly about the procedure. I don't have the surgical step and all those stuff. I will have gone into the anatomy very well. So what we'll do in gastric sleeve, basically, we can see the normal outline of the uterus, sorry, of the stomach. Pardon me. So we have the esophagus, the stomach, and the duodenum. We can see the small intestine. What we do in gastric sleeve is that you can see the smaller curvature and the lesser curvature and the greater curvature. So from JOJ, and you can see the angle of the stomach. So the surgeon will tend to actually do a lot of bit of work before going to sleeve proper. All the our stomach, we have omentum and everything will be separated. Then before we do whatever, there's a tube also that will be put into patients, pass through the patient mouth to the stomach. We call it a gastric tube. The gastric tube, it comes in sizes. So depending on the preference of the surgeon, so the tube is to guide the amount of stomach that will be left behind. That is, let me say, see the blue, what's it called? So the tube will come in here. So this is the tube that will guide, okay, I want maybe so portion of stomach to be removed. So the tube will come in here and it will guide the number, the amounts, the amount of part of stomach you want to remain. You understand? So the tube will be passed to decompress the stomach. The surgeon will have worked by separating the omentum, and the artery, gastric artery and vein will also be preserved. You understand? All those things will be done before the sleeve itself is done. So when all these things are being done, tube in patients, we suck whether the gas or any content in the stomach as well. We suck it out. Then you prepare the stomach itself, omentum, you preserve the vessels and all those stuff. So then another thing is that in all this in gastric sleeve procedure, you have to be very careful because directly we have at the fundal area, we have the spleen. So most time the spleen is sitting, and at the body the pancreas is sitting. So most time, and the omentum and pancreas sometimes they look alike. So in separation of this, there's a bit of carefulness. So those are the preparation before sleep. So what will happen is that after the sleep, after the tip has been put in, so we have a lot of instruments. It's a laparoscopic procedure. So we have staples, we have clip that is the staples. All these things we are saying is staples. And so let's say the tube is inside. So there will be a stapler. The stapler, this is the staples line, the staple to clip this part. And when we staple, then stapler does two work. It cuts and it seals. So after cutting, it's automatically sealed. So any other things, maybe the bleeding, the control will be done by using clip. So we use clip, then sometimes we use diatemi to secure hemostasis. So after this is done, then we do a leak test. We'll do a leak test. So there will be a clamp at the duodenum here. Then through the tube, a dye test will be done, whether there's a leakage. So those are the things that we do in gastric sleeve. So, and that's the procedure. I can't actually put everything here because of our time. So then let me just read through what I have here. I believe we all understand how the procedure is being done, if I'm right. So the gastric sleeve simply remove about large portion of stomach, about 80%, leave behind a small portion. So this is about 80% of part that is being removed. Imagine out of 100%, they remove part of 80% of stomach. You see how, that's what I'm saying, that it's not easy. So, and a small portion, so this is the part of the stomach that is being left. And this, I said this is measured by gastric tube. So it is a guide to know the amount. I think it ranges from 25, 22, depending on the assessment of patients. So this naturally reduces the amount of food consumed in one sitting and makes one feel fuller faster. So when you have this portion, so you eat small quantity of food and you feel full faster, but it also reduces the hunger hormone. So you feel hungry less. So that's why we say that bariatric surgery also helps in what there's a connection between the digestive system and the brain. So it reduces the hunger signal. So advantage to this procedure includes significant weight loss and no rerouting of intestine. So rerouting of intestine is just like sometimes when the staples is not well placed, there will be a twist and all those stuff. But most of the time when you are doing your staples is being done carefully. You make sure the stomach is not twist. You make sure the stomach is placed in a good and proper anatomical place before you even apply your staple. So sleeve gastrectomy also require a short hospital stay than other procedure. Like I said, from my own facility, at most, early morning of the third day, they are out of the hospital. So you can see a patient will drive in for sleeve gastrectomy. The next day going, she drove out. You won't know. Some of them, they will not even tell their family or relatives that I'm going for surgery. Most of them do it. And the world we are now, most of ladies especially, you want cosmetic purpose. So they will just go and do it. And because there will be less scar, nobody will, it will be very difficult to know, have you had any operation done before? Because, the scar will be very, very small. So when we're talking of sleeve gastrectomy, so this is the procedure we are talking about. Portion of the stomach is being removed, leaving like about 20% of stomach. And what it does is that it helps you to help you have a less hunger signal, then you get food is faster. Then also it helps in weight loss, significant weight loss. It also helps there. So, and when we are talking about sleeve gastrectomy, the success rate is on the high side as well. We have a good success rate, and I don't want to be using, I have a lot of studies. I don't want to be using those studies to go. There's a good success rate of sleeve gastrectomy worldwide. So the second, because of our time, the second type of bariatric surgery we'll be talking about is gastric bypass. Gastric bypass is also known as TORG-NG. That's a French term meaning in the form of letter Y. And I'll be using this cursor to do, see, in form of letter Y. See, so what happened in gastric bypass is that we want to bypass the stomach. Most of the surgery, sleeve also explain what sleeve is. Bypass also explain what bypass. We want to bypass the stomach. So can we also see the anatomy of the stomach and the esophagus and the duodenum? You can see it. So we can see what happened on surgery. So what really happened is the same procedure and same preparation we do for gastric sleeve, and we have similar preparation of patients for both all the bariatric surgery as well. So this one as well, the same preparation the surgeon will do when they get inside. You separate the gastric artery, gastric vein, all the vessel. So the surgeon will work entirely on the antrum, the fundus, part of the antrum, the fundus, and part of the lesser corpus. So they are the that's where the surgeon will work by separating most of things here. The omentum, there's some other part of vessels that are attached. So in preparation for this, then so what will really happen is that part of we can see that this is duodenum. This is jejunum. And if you can remember, we said what happened in jejunum when we are doing the anatomy overview, that basically most of our absorption takes place there. So what will really happen is that part of the small intestine. So what they do is that from this stomach, this line will be staples. We can see all these dot. They are staples. They are staples line. So this part will be staples to bypass this, to bypass all of this. Then we now bring up part of small intestine to join the small portion of the stomach that is remaining. So that means we have equally reduced the volume of the stomach as well, so that the food that is coming here will now come straight here. Some part of this is for bile secretion to supply. So this is basically what happened in gastric bypass. So back when we say gastric bypass, the procedure, like the meaning in the form of, okay, with this procedure, small intestine we end up in that form. Like small intestine will end up in form of Y. We can see it, this and this and this. That is Y. So first, the surgeon creates a small pouch at the top of stomach. So the surgeon will create this place. We create a pouch like this, separating it from the lower portion with surgical staples. Like I said, these are the staples line. Then they divide small intestine and bring the new segment up to connect to the stomach pouch. So these are the small intestine, especially, so it will be divided. One end will go to part of the duodenum and the other end will go to the pouch. So, and what does this one, what food will now flow through the new smaller stomach and lower segments of smaller intestine, bypassing the rest. This restricts how much stomach can hold and also how much nutrition small intestine can absorb. So it's two ways to eat. This one will equally reduce how much food you can take, and equally the absorption will be reduced as well. So like I said earlier, when I'm talking about gastric sleeve, it's the same principle, the same mechanism, and the same purpose. The same purpose they serve. So this one too is become smaller, absorption is lower. So restricting the small intestine make this method more effective because of what? Because of absorption than gastric restriction alone. So gastric sleeve is just restriction from the stomach alone. But this one now include both the stomach and the small intestine. So it's making more effective in terms of absorbing and in terms of the reservoir. The reservoir now is small, very smaller, and absorption too will be reduced. So this is what happened in gastric bypass. Also in gastric bypass, there will be a leak test as well. So to test whether our staples is intact and whether there's no leakage as well. So the third one we are talking is adjustable gastric band. And Adjustable gastric band is in this type of surgery. What we have, I don't know, for many people that have knowledge of that witness bariatric surgery very well, it's a form of surgeon places a ring with an inner inflatable band around the top of stomach, excuse me, to create a small pouch. We can see it. You can see the gastric band here. We can see it here. So the surgeon will place it. All these procedures are being done laparoscopically. So like a gastric sleeve and gastric bypass surgery, the gastric band makes one feel full, eating a small amount of food. The inner band has a circular balloon inside that is filled with saline solution. The surgeon can adjust the inner band to resize the opening from pouch to the rest of the stomach by injecting or removing the saline solution through the small device that is connected to the nose. Simply what the gastric band does is that the gastric band here create a small pouch here, then will be filled with saline. This is just to occlude restriction movement of food so that the amount of food taken, you understand, will not be as the normal one the patient used to take. So now there's opportunity for adjustment here. We can see this like a podcast. If you know podcast, these are what podcast is like. Podcast also has allow flow. So this is the place. So if the saline inside this balloon is too tight and patient is feeling uncomfortable, so the surgeon will come at any time to reduce it. But if it is too small, that the patient is not, there's no effective gastric band surgery effect, there's no effective after doing the surgery, the surgeon might take a look and see that whether the saline here is too small, then you will top it up. So basically, we can see there's a similarity in all these bariatric surgery we are talking about. So simply is a balloon that is a inflatable band around the top of stomach at the front. It includes the fundus part of the stomach, is the upper part of the stomach. Then it will create a small pouch. We can see it. We can see everything, and that's why I put the picture. So those are the things that really happen when we're talking about adjustable band. After surgery, you will need several follow-up. Like I said, adjust the size of the band opening. If the band cause problem or is not helping you lose enough weight, the surgeon may remove it. So if it's not really helping, the surgeon may remove this. Unlike the sleeve and the bypass, those ones, they are permanent. But this one, this is temporary. This one can be removed. So today, adjustable gastric band surgery is less commonly performed in United States compared with the gastric sleeve or gastric bypass because it is associated with more complication, predominantly the need for band removed due to intolerance. So, and some patients might even feel like they are uncomfortable. Some people might be saying they are feeling choked. Some people that they are having a kind of reflux. A lot of complication is associated with this one. I've not seen it done in Nigeria as well. I've not seen it done anywhere. I've not seen it done as well. So it's not common. It's not common. So gastric band surgery also typically results in significantly less weight loss, and it is associated with more complication. So these are the reason why they don't do it. So, and it's not something that you can just say, okay, let's try this. So you have to select what works for your patient. So, but a gastric band is not equally encouraged in Nigeria as well, not only in United States as well. So that's what really happened in gastric band, adjustable gastric band. So the last one we are talking about is pancreatic diversion with duodenal switch. So in this procedure, is a surgical procedure, is the same process and the same preparation for all other bariatric surgery. this one, we have the first procedure is combination of gastric sleeve, and the second one is combination. Sorry, I said this procedure is combination of gastric sleeve and bypass. So the first do gastric sleeve, we can see it, portion of stomach is being taken, but this time it's not up to 80% of stomach. As you can see, it's the same process. Then there will be a bypass as well. So these are two procedures that is being carried out in a patient when we are doing a biliopancreatic diversion. We are diverting, we are doing diversion with duodenal switch. So now we can see that jejunum is now linking to the taking the place of duodenum. So there's a linking here that connects here. That's a bypass, and that's a sleeve that's been done. So the first procedure is similar to gastric sleeve surgery. A second surgical procedure divides the small intestine into two tracts. We can see it here. Food moves through one tract by passing most of small intestine. This reduces the number of calories and amount of nutrients absorbed. So we can see constant repetition, reduction of absorption of calories, and reduction in number of calories, amount of nutrients absorbed. So it's the same protocol. This type of surgery allows you to lose more weight compared with other three types of described above, because it's a combination of two surgery, gastric sleeve like and bypass. So, however, it also most likely to cause surgery-related problem and a shortage of vitamins, mineral, and protein in body. For this reason, surgeons do not perform this particular procedure often. So it's less performed as well compared to gastric bypass and gastric sleeve. So, however, some surgeons may recommend it for patients who have severe obesity and certain health conditions. So this is a type of surgery that is being encouraged for people that are having severe obesity and extreme obesity. They will benefit a lot from this, but there's a risk of complication as well. So because of our time, we are talking about how much weight do you lose with bariatric surgery. We say most people about 90%. Like about 90% of people lose 50% of their excess weight after bariatric surgery. That's a lot. And that's why, as I say, we have a success rate of bariatric surgery in reducing weight loss. Different procedure have slight different results. So, well, the average weight loss of gastric bypass is about 70%. Wow. So we have about 70% of weight loss when you do a gastric bypass. Excess body weight after the duodenal switch is about 80%. That's why they said that they will recommend that for people with excess obesity. So for gastrectomy, sleeve gastrectomy, we have about 30% to 80%. So, and this result measure after a period of 18 to 24 months. I've seen people with 12 months. I've seen people with 6 months. So they started having result after 6 months and 12 months. So we have some complications. So we have bleeding, infection, blood clots, hernia, small bowel obstruction, and anastomosis leak. It's very, very common. Those are the complications we have, especially most complication that has ever occurred is bleeding and leak, and it's very rare. Small bowel obstruction is very, very rare as well. So those are the complications we have in bariatric surgery. So here we have, excuse me, surgery side effect. We have dumping syndrome, malabsorption, malnutrition, bile reflux, gallstone. Those are the surgery side effects. I'll just be reading through. I think I've passed through. I'm behind my time now. So these are the surgery side effects. Dumping syndrome is collection of symptoms that can occur when your stomach dump food too fast into your system. You know, sometimes when you eat quickly, you sometimes might have stomach upset. So it's just the way the digestive system react to it when you have a bite. So with malabsorption, malnutrition, that one is straightforward. Bile reflux because of there will be restriction and all the bypass and every other thing. So there might be reflux. Then gallstone as well is another risk, so side effect. So also we have the next one, advantage of bariatric surgery, significant sustained weight loss. You can't argue this, and because it's fact. Significant sustained weight loss, especially class 3 obesity. It comes and reduce hunger hormone and improve metabolism. I said the other time that if you have anybody around you that say, doctor, nurse, health worker, what can I use? I'm hungry. I'm hungry too much. Tell them to do what? Consult their surgeon for bariatric surgery. So it reduces hunger hormone and improve metabolism. Then another thing, advantage is cholesterol and blood sugar management. Like I said, one of those things that obesity causes, we can remember high cholesterol, blood sugar, hyperglycemia, and all those stuff. So you can see how cholesterol and blood sugar management will be maintained. Now, I don't want to go into physiology details. We know how it happened. So weight loss surgery often causes remission of diabetes symptoms and allow people with serious metabolic syndrome to discontinue medication. So it's also then we have a longer, healthier life. It makes us, when we look light, it makes us to live longer and healthier. It might amaze me. It amazes me when I see ladies that they are very slim, looking for flesh and fats. And it amazes me when I see obese one looking how to shed those fats. So we can see life is not balanced. So it's when you're light, it makes you look longer and healthier, and that's one of the advantages of bariatric surgery. And we have what is the success rate. I said we have weight loss surgery is considered successfully if you lose 50% of your excess weight. By the standard, the success rate is 90%. 90%. 90, I should bold this 90. Many people experience steady weight loss for the first 2 years, then store or regain some weight after that, usually the weight gain. So there's a possibility of you losing weight, and after some years you regain it, but you won't gain as much as you're supposed to gain, less than 25%. So that's the success rate of bariatric surgery. So I think with that, we come to the end of presentation. Thank you everybody for listening. And if there's any question, and I think we move to WhatsApp to take that. So I'll hand over to the moderator. Thank you very much.
Thank you so much, sir. Thank you. Thank you so much. That was both very detailed and enlightening session. Thank you, sir. It was very
Thank
funny.
you.
It was very funny when you said some people are looking for weight and others are looking to lose theirs.
Yeah, it's very funny. I've used them a lot now.
This life, no balance.
It's not balanced at all.
Thank you so much, Mr.
No
Adewoyin.
balance
That
at all.
was very detailed. Thanks a
Thank you,
million for the
thank you.
Very
presentation.
engaging and educational. Thank
Yeah.
you. Thank you. Let's move over to the WhatsApp, please.
All right.
All right. Thank you, sir.
Thank you, everyone, for joining.
Thank you, Ma. Thank you for having us.